Hi, Scott Beilfuss here. I'm running for House District 55, and I wanted to talk a little bit about one of my passions and what I would work for you doing in Denver, and that is in the area of healthcare. I had a small business here for 30 years, and one of the things I learned in talking to my customers, who are mostly middle-class, blue-collar workers, was that it's really difficult to live here and get affordable health care and get coverage for your whole family. And the way I learned that pretty much was by collecting on the products I was selling. A lot of times I would go to deliver products and find out that families were having a real hard time. A lot of times it was one of three things. It was family breakup, very sad. Sometimes it was loss of jobs with our economy going up and down. But a lot of times it also was healthcare costs. And I was really surprised at that. And doing a little research, this was about 15, 20 years ago, I found that Mesa County had 26% of their adults uninsured, which to me was mind-boggling. How can 26% of your population not have any health care insurance? So it became an interest to me through my own family's healthcare issues, my parents' healthcare issues. More and more became a critical issue. I got affiliated with, local groups, some state groups, some national groups that worked on the healthcare issue, and along came the Affordable Care Act. Now, as controversial as it is, it helped a lot of people in this county get insurance. Because of the low incomes here, a lot of people got the Medicaid expansion enrollment. We now have 33% of the county on Medicaid here. It's sad to say 33% are on Medicaid simply because that indicates it's pretty low income, but they have coverage, and they have very good coverage. What that did for the area is bring down our uninsured rate from 26% to only about 10 or 11%. Now that percentage is still high when you think about people having no insurance at all. The other side of that is that a lot of people around here that have to buy private care insurance, there's actually a fairly low number that get insurance around here through their employers. So many people have to go to the healthcare exchange and buy insurance, and for a family of 4 or 5, that can be up to $2,000 a month for just average insurance with fairly large deductibles and copays. And that is crushing for people around here. The incomes, again, are not that high. Our median family income is $58,000 a year. $2,000 insurance bill a month, that's more than your house and car payment put together. So it's not attainable. So it's one of my goals to help bring affordable insurance to Mesa County and to the state of Colorado. There's a lot of different ways we can work on that. One is the community rating system, which puts us in one of the highest ratings in the country, to work on that. I want to work on why people are uninsured. I think there's probably some research that needs to be done out there that would be very valuable to solving this healthcare problem. We want everybody insured so that they can pursue their dreams. And also, some of the insurance issues with why are healthcare costs so high here? I think there's been studies done statewide, but not so much locally. I would be able to work on that in Denver for the people that I represent. So that's a real passion of mine, and we need some more primary care here. I've actually talked with local medical providers about that. We're short about 25 primary care physicians around here, and usually there's one physician for every, I believe it's 2,000 people. So there's a lot of people that have a hard time getting primary care, and that's something I would work at. CMU has a nice program for physician assistants. That will help, I think, towards our primary care needs, but I'd like to support that. So there's a lot of things to work on here. I shouldn't forget too, the elderly. We have a lot of people moving to Grand Junction that are retired. They're not necessarily elderly, but someday they will be. I know a lot of those folks that are on Medicare have a hard time finding primary care here, and I would work on that as well. So lots of things to work on. Send me to Denver and I'll work on that for you.